Okay, so you must be Ellen K. I'm Dr. Brock Hollett. So I am a psychiatry resident here at Centerstone of Florida, and I wanted to visit with you a little bit about why you're here and about your stay. Very nice to meet you.
Thanks.
Yeah, so tell me a little bit about what brings you into the hospital.
I got arrested. The police brought me here.
Okay, I see. Yeah, I was looking at the Baker Act form here. That was, it looks like the police had brought you in from the Manatee County Sheriff's Office, and it says that you were at, I guess, Gecko's Bar and Grill. You'd made some kind of statement or something. Can you tell me a little bit about what you had said or what happened?
I mean, I don't really remember.
Okay. So when you, this happened, I guess, last night, right?
Yeah.
Okay. And who were you with at the time?
I'd gone out, met some people, friends or whatever.
Okay. All right. So, kind of in your own words, I mean, are you wanting to die today? Is it something that you've been thinking about?
No, I mean, I don't want to die. Is that what that says? That I want to die?
Yeah, I mean, it says that you had made a statement that you wanted to die.
No, I don't want to die. I just feel like shit. I don't want to die.
Okay, all right. Yeah, I'm sorry to hear that you're feeling bad. Tell me, what you're feeling emotionally.
I mean, right now I want to get the fuck out of here.
Okay, I can understand that. Yeah.
And I'm really tired, and I don't think I should be here.
Okay. Tell me why you feel like you shouldn't be here.
Well, I don't think this is going to make me feel any better or solve anything in my life. I don't want to kill myself. I have kids at home. Like, I have stuff to do. This isn't making anything better being here.
Yes. Okay. Yeah, and I'm really sorry that How would you describe your mood prior to this use of cocaine? How would you describe your mood sort of overall?
I mean, I was about as depressed as I've ever been in my life.
Okay.
I was just...
How long have you been feeling that way?
I mean, it's been... I went on the Abilify like 9 months ago in hopes of feeling better. And I did feel slightly better for a while. And then just like everything got worse and worse and worse. Like for at least the past 6 months. It's like I just can't drag myself out of it. Nothing changes.
I see. You said for at least 12 months?
I don't know. With the Abilify, I've been on it for like 9 months, I think. And then, yeah, I was probably feeling bad for about 3 months before then.
I see.
Probably.
Did anything trigger that, or did it just sort of come on?
Things were going really well, actually. Like, my housekeeping clients were really happy with the work I was doing. I was getting more, and the work at Wawa was good. My kids were doing great at their school, and my relationship is actually really solid. We've been together for like 3 years. It was good. It was there was nothing. There was nothing that I could point at that.
Okay, that triggered it?
Yeah.
Okay. So do you feel like the depression comes and goes for a while, or is it consistent, as long as you can remember kind of thing?
No, it comes and it goes. I mean, I guess my mother did die, like, she died like 5 years ago, and it's, like, I've definitely had, I mean, that was a blow, but I also kind of, I've been happy and productive since she died. I've processed that, but I am like more, I guess I'm quicker to get down since she died.
I see.
But nothing's like stuck like this.
Do you feel like her death triggered it, or it just made it worse?
I mean, I've always had this depression since adolescence.
Okay, I see.
And it comes and it goes, like it's its own thing. But like this, since my mother died, I just feel like I'm less like resilient, I guess, or less able to
Okay.
to cope with small things. But there's,
I see. Any sleep issues, trouble falling or staying asleep, or both?
So both. I have trouble falling asleep, and then the main thing is I wake up at like 2:30, like kind of all the time, and can't really get back to sleep. Or sometimes I do, and then I'm sleeping like I'm so tired during the afternoon. It's like I'm just dragging my body.
I see. Has sleep always been an issue, or just when you're depressed?
No, but just when I'm depressed.
I see. Okay. Do you feel like your thoughts go too fast, or you have racing thoughts? Do you ever go days in a row without needing sleep or having too much energy? All right. Do you ever hear voices or hear things that other people don't?
So like sometimes with the cocaine, it makes me kind of hear things. Sometimes when I've been at my worst, there are days where I can't sort of stop the voice in my head talking about how like bad I am. I mean, and it's true. So I don't know if it's a hallucination or anything. I think it's just a voice.
Does it feel like it's your own voice, or is it separate from you?
It's kind of it's like a man's voice.
Okay, just one person, one man's voice.
It's two men's. Well, sometimes it sounds like my dad, and sometimes it sounds like the father of my children.
Okay.
Like, when I feel like I've been a really bad mother, it sounds like the husband of my children.
I see. So okay, and the content of what they say is they put you down and things like that. But what about, do they ever command anything or tell you to do stuff?
Like they tell me to get off the couch or something like that, but they don't.
Okay. And with the voices, do you only hear the voices when you're using, or do you also hear them when you're not using?
I mean, I hear those voices when I'm not using them. I'm just like...
Okay. All right. And do you hear them when your mood is stable, when you're feeling okay?
No, when I feel okay, like I am...
At 10 milligrams, we could either keep it at 10 milligrams for now for the anxiety and mood. You said it had some effectiveness, right, at some point? Is that right? Maybe? Or...
I think so.
Okay.
Like earlier in my life it did. Yeah.
Okay. So you're not really having, you don't have a clear picture of bipolar disorder at this point, so I think it's probably okay to go up to 15 milligrams and see how that goes, all right, while you're here. But I think your medicines are probably too low. So before we decide to give up on them or try something else, I think it makes the best sense to go ahead and try to maximize their, get you in that therapeutic range before we decide whether or not they're working. Does that make sense?
Yeah.
Okay. And Lexapro, the most common side effects would be GI symptoms, so bloating, gas, diarrhea, constipation, belly tenderness. Those are all very rare side effects, but they are the most common for that medicine, okay? And then for Abilify, the most common side effect that we see is feeling physically restless, like you need to bounce your legs or move around. And if that happens, then we would want to stop the medicines, of course. Now, you're detoxing, so you might experience those symptoms anyway, but if those were to persist outside of the hospital, then, those would be, we see that in about 1 in 5 patients on Abilify, okay? So at this point, first, I just want to thank you for spending, I know it's a lot of time to get all that information, but it really does help us with your treatment while you're here at the hospital. So I appreciate you spending the time with me. and I want to let you get back to your room so that you can rest. And like I said, if you need anything, let us know. Our job is to help you feel better while you're here at the hospital. And I know you don't want to be here, but unfortunately, you know, we do have to keep you for a couple days, right? Usually we keep the patient about 3 days, right? So that we can evaluate you and make sure you're safe. You know, I know you say that you don't want to die, but you know, we don't know you yet. So we're getting to know you. So we want to assess and make sure you're safe. But also, since you're our guest anyway, we want to make sure that we treat you while you're here so that your stay is worthwhile and that you can go home and get back to your life and hopefully go back with not feeling down and not feeling overwhelmed. That's our goal. We want you to be able to go home to those sweet kids and you know, feel good again. Does that make sense?
Okay.
All right. So that's our goal. Each day we'll meet with you. Our treatment team will meet with you. If it's on the weekend, you know, it may be that you're only seen once, usually during the weekend, but during the weeks, our treatment team will meet with you every day and try to adjust your medicines as needed so that we can get you feeling better. Okay. And until then, just let us know if you need anything.
Okay.
Do you have any questions or concerns for me?
Can I call my kids?
So we do have call hours, and so ask the nurse about that. But we have sometimes if they don't have a lot going on, they will let you use the phone. But we also have visiting hours. I want to say 4 p.m. You'll have to ask them exactly because I forget, but you should be able to make a phone call during that time if they are busy at present. Okay, and then so just be patient with them, and they'll work with you. All right, and if you need anything, just let us know.
Okay.
All right, very nice to meet you.